Hello, dear friends. So, today we're going to discuss about a very common disorder. Nowadays, cases have been coming to the OPDs that they is suffering from kidney stones. So, what is kidney stone? What are the signs and symptoms, and how it is being treated? Kidney stones is nothing but stone is something that is made up of some particles. And what is the function of kidney is to uh, filter the blood. So during this filtration, there has been some particles which might be called stone forming component. That is, it is made up of calcium. It is oxalate. It is calcium phosphate. It's cysteine. Then uric acid. These are the stone forming components. So sometimes what happens whenever sometimes the fluid levels it sometimes get down, water level get the patient will not take proper water, and these stone forming elements get increased. So at that time the proportion is not maintained, and due to this component is get increased, stone forming component get increased, and they started depositing in certain part of kidney. This is called Randall's plaque, and after day by day these plaques get increased, and after that certain period of time this stone is get formed. So, what are the common causes of this? Uh, we have seen that these are the process and how these uh, stones get formed. So, the most common cause nowadays in India is considered to be hereditary. The most of the time, this stone, renal stone patient is we have seen in the that they consider to be a familiar inheritance. So most of the time, sometimes it may be dietary, because there have been some certain randomized control trials has been we have seen that it considered to be. So we are more focusing toward this kind of which are the kind of these stone. So treatment will depend upon the which kind of a stone is there in the kidney. So for that we have to do the 24 hours urine sampling. So we have to collect all this 24 hours urine, and then we have to see which other component is greatly rising in this case, this fluid. So this is the commonest procedure that we are doing in the OPDs. So what are the common symptoms that we often see in the kidney stone patient? So the main symptom is abdominal pain, which from the side called flank. Sometimes it's radiated towards the groin, and sometimes it also irritates the urine. And we often see there has been some a reddish tinge in the urine, which it consists of blood. And after that some patient is having some very high grade of fever, then rigors. These are the common symptoms. Sometimes some patients, if sometimes this stone is whenever they come into the ureter, that is the tube which is connecting from kidney to bladder. Sometimes whenever this is lodged in the ureter, they sometimes form the patient get more nausea, sometimes they vomit. So these sometimes need a proper intervention, surgical intervention. Sometimes it involuntary and voluntary gets passed into the urine. So these are the process of stone formation. So what are the ideal thing that we can do in this kind of a patient? So very first thing is that if the patient is having uh, fever, high grade of fever, then high grade of chill, then we have to do the plain CBC. In this, we can see that the patient is greatly increased WBC, neutrophils is get increased. After that, the ideal line of treatment is CT scan. Ideally, nowadays in India, we often see that all the doctors they're doing sonography for the renal stone, but ideally it considered to be that we must go for the CT scan only. So after that, we have to select the appropriate line of treatment. If it is the stone is depend upon the treatment is depend upon where the location of the stone, what are the side is what are the symptom that is being created, and so it depend upon all these factors. Sometimes we have to also consider the comorbidities of patient. Sometimes the patient has solitary kidney, that is one kidney present, then we have to do a one fast intervention in that patient. Then if we take if at all we consider about homeopathy, that homeopathy has a lot of medicine to reduce the size of kidney, reduce the size of renal stone, that is kidney stone, or sometime we can uh, move this stone into ureter, and sometime it will get passed. So we depend upon on which phase or which situation, which circumstances patient come or approach to homeopathy. So it will totally depend on the case. So with homeopathy, we can definitely do a very great treatment with these kind of cases. So it needs so if you have this kind of uh, disease in stone, then you must approach with a good homeopath. It will be helpful for your recurrence, that if at all you have that continued recurrence of kidney formation, then definitely homeopathy can help you. So I think this video is helpful for you. So thank you so much.